whenever you speak to another reproductive specialist about just saying the word inflammation, many will look and say, what are you talking about? What does that even have to do with fertility? But it has to do with so much.
Hustle culture, nobody's sleeping, everybody's hustling. It shouldn't really be surprising to us that we are seeing end game changes based on what we've normalized as a society.
Stress sometimes just sort of hits you and you fall. And so you have to have pillows.
And I think you and I both feel like we'd love to put ourselves out of business in a way. If we could hear people sit in front of us fewer times and say, if only I had known this, I would have done something different.
Good morning, Nat.
Hi, Sasha.
Dr. Natalie Crawford here with me today. Dear friend for a long time now.
I'm so excited to be here, and I'm so excited about your podcast and how amazing it's doing. So thank you for having me.
Thank you for always pushing me. I feel like you were the driving force from the beginning, you and my husband.
Good. Well,
and so
somebody needs to be, and
yes,
happy for it to be me.
Yes. Thank you. Thank you. And I'm so excited to talk about your book.
Thank you.
I got a pre-released version of it.
Yeah, you're one of the few people who has seen the final PDF version before it all got even formatted. So there's very few people in that club, but
thank you. I'm honored, and I'm
trust
obsessed.
you. And we're so aligned on so many things on how we approach patient care and how we view fertility as a whole.
Yeah,
that I knew you would love it. So
yes,
I sent it easily, being like, I know you will love this. Here you go.
Love, 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 love. Because I think in our field we tend to focus a lot on just the the pharmacologic aspect of treatment. IVF, all these things are important. They're really important. However, I think that we tend to push a little too much that it's only luck. It is only your biology that you were born with. There is nothing you can do. And there's a huge underestimation on how lifestyle can impact not only your overall health, but your reproductive health.
Absolutely. And it goes two ways, right? There's some circumstances where you will need IVF and people will need the most advanced technology.
Yeah.
But that doesn't mean that lifestyle factors, decreasing inflammation aren't going to influence your success rates or what that journey is going to be like. And I think you and I both feel like we'd love to put ourselves out of business in a way, meaning if more people could get pregnant without having to go to these extremes, if we could hear people sit in front of us fewer times and say, if only I had known this, I would have done something different.
So many times.
So many times we hear that. And I think it's because there's a lot of stigma to women's health. There's a lack of research in things that are not financially profitable. And so there's this aspect of women's health that has been largely ignored. And it leaves women in a place where when do you learn about your fertility? When do you have discussions about cycle tracking? When do we talk about your gut health and gut microbiome and how the world around you influences your hormones? The truth is most people don't learn about it until maybe they have a problem and they're really starting to do a deep dive or search for answers on their own. And that shouldn't have to be something you have to fail to then get help for. It really should be more proactive. If our field wants to call infertility a disease, which you and I both agree with, why are we accepting a reactive approach? When on earth do we not look at a disease and say, how do we prevent this disease? How do we test for this disease earlier? We would never take, high cholesterol, heart attacks and wait. We do preventive screening. We talk about how to prevent this. So as infertility rates are rising, as the world around us is becoming more inflammatory, we have to be in a position to say, infertility is a disease, but how do we work on having fewer people have to experience it to the degree that they are? How do we put these conversations front facing? And can we be in a position for some cases of infertility to prevent it? And you and I both know the answer is yes.
Yeah. And I mean, there's so much that you just said right now that I love, because the prevention piece is huge. We never think of prevention in the field of infertility. Once you've got the diagnosis, now we're treating. But yes, prevention is a huge part, and there are ways to prevent certain things when it comes to reproductive disorders that could be identified early, and maybe even altogether avoided if we understand how certain lifestyle factors can impact our reproduction. Yeah. And if it affects our overall health, of course, it's going to affect our reproduction as well. So
for too long we've let our medical system be very disconnected.
Right.
And you got reproductive health, cardiac health, bone health. Everybody's in these different tangents. And that's part of the problem with the system because that's how we train.
Right.
But it's a failure of our own as subspecialists to stay in our bubble and not step back and look. There's plethora of data showing that if you have infertility, so you and I both get to fall into this category, that we have higher risks of metabolic syndrome, heart attack, stroke, cancer. And why is that? It's not that infertility causes any of those things. It's actually that a lot of the underlying factors that contribute to infertility are also causing chronic inflammation that's causing long-term harm. So your fertility is also a health marker, and it's something that's worth discussing. What is that? Proper hormonal function. And this idea that the entire definition of infertility, oh, you've got to fail first. Like you have to try for 12 months,
Right.
you have to fail. Then you can enter into testing to even see what's going on. I really think it's time for us to refocus how we approach fertility as a field, but also how we approach it for our patients and for the public and as women individually. How are we going to approach this? I think about my daughter. What am I going to talk to
Right.
her about as she starts
Yeah.
to navigate this world of her own reproductive health?
Even I think about it for my sons
Yeah.
too, because I'm like, what are these lifestyle factors going to do to influence their sperm in the future? Is this something that we're going to have to talk about? And it is something that we're probably going to have to talk about. And that's just our reality. And it's not a bad thing. It's a good thing. Education is incredibly
Absolutely.
powerful.
Yeah, I mean, there's a statistic, right, that sperm counts have decreased 50% in 50
Right.
years, but the most rapid decline has been in the last 15 to 20 years. So we really think about how the world is in the last 15 to 20 years, which we know is highly inflammatory, tons of environmental toxins. Think about the food that we
Yeah.
eat, hustle culture, nobody's sleeping, everybody's hustling. It shouldn't really be
Yeah.
surprising to us that we are seeing these end game changes based on what we've normalized as a society.
Yeah. And as you talk about inflammation, am I allowed to say that this is the beginning, one of the first chapters
Yes,
in the
of
book?
course.
It is a really well written chapter. And so I really want us to dive into this and for you to talk about inflammation because I think that whenever you speak to another reproductive specialist about just saying the word inflammation, many will look and say, what are you talking about? What does that even have to do with fertility? But it has to do with so much.
It's
So,
kind of shocking in a way when you think about it because, of course, every doctor learns about inflammation and we learn
right.
about it in med school and we learn about it on disease pathways. I even talked about it in my oral boards for REI, but solely limited to the context of endometriosis.
Hmm.
But my kind of fascination with this, and you're right, the first chapter is called How Inflammation Hijacks Your Fertility. So, like, we're coming out strong
Yeah.
with this. Was that, I had my own infertility story and I had
Right.
multiple pregnancy losses. So I had 4 pregnancy losses. Part of this time was the end of my OBGYN training and then the beginning of fellowship. And it was very hard, as you know, to be in this line of work, to be doubting what your own body can do, to have questions as somebody who's supposed to be an expert and have them dismissed by my own physicians. It really shined a light on the patient experience. But the one bratty thing I did at that time period is we have to do a research project. So in REI
Right.
fellowship, right, half the time is clinical and at least half is research.
Right.
And what was your research project on? What was your
Um,
thesis?
it was on Malarian anomalies and the genetic contribution of
Oh,
it.
that's fascinating.
So yeah.
So most people do a very like finite project and it's
Right.
usually something that's lab based in some way because it's easier to control your variables and you have to sit at your oral boards and
Yeah.
defend this project. So most people where I was either did lab research on endometriosis or IVF. And that was kind of, these
Right.
are the pathways you can choose from. And I pranced in there and said, hey, I want to study natural fertility. And they're like, well, nobody really does that. And I was like, well, we've got Ann Steiner, and she's like, world-renowned epidemiologist who studies this. I mean, she's a physician, but has an MPH. And I was like, but this is what I want to do. These are the questions I have. These are the questions our patients have. And they said, well, if you're going to do that, you have to get a master's in clinical research. And I was like, great, you're paying for it? Sign me up. So I start going down this pathway of really diving into clinical research and we looked at the luteal phase, we looked at short luteal phase, ovarian reserve, vitamin D levels, environmental toxins, and started diving in. And the one thing I saw, despite these topics seemingly being non-related, was inflammation everywhere. People are
Mm.
mentioning that in these cases, people had more inflammation or hypothesizing that inflammation was on the pathway for why people had low ovarian reserve or how environmental toxins harmed our fertility. And it was really eye-opening to me because we don't talk about it day to day. I'm in my fellowship and we're not talking about
Right.
inflammation.
Hmm.
And at this point, I was in the pathway where after 4 pregnancy losses, my next option was essentially IVF with a normal workup. It's like, hey, everything's normal. We don't really have an answer for why this is happening. You can do IVF, but you're the clinical fellow. So you can't quite do it yet. I mean, you know how it is, right? And
Yeah.
at the time, right, I mean, being a fertility doctor is a huge goal. So it didn't necessarily bother me. It's like, okay, that's the time in my career path that I can do this. But what am I going to do in the interim? Because if I know this is coming, surely there should be things I should do to prepare
Right.
myself.
Right.
But what is the answer we get from the world around us or from our own providers? It doesn't matter. Nothing, it's fine. IVF will cover it. That's kind of the messaging that I got. But did my N of one experiment, which of course is an N of one. But I said, you know what? In all my research, as I'm studying natural fertility and I'm studying menstrual cycles, I'm seeing inflammation over and over. But what causes inflammation? What are the symptoms of it? And so, really, we threw out all kinds of things in our kitchen. We changed how we ate, we changed a lot of the lifestyle factors around our world. And I started tracking my cycle for real, which I'd never really done before, and said, oh, I have a short luteal phase. I was like, well, you want to do Clomid before you do IVF since you can't do it yet? And I ended up getting pregnant and staying pregnant in that zone. And I think a lot of it was that I modified my own risk factors by decreasing
Hmm.
inflammation,
Hmm.
learned about my own cycle and being a little bit more proactive, still anticipating doing IVF, but changing what I was doing. And of course, a decade later, I got diagnosed with celiac disease. And when I was listening to my body and
Crazy,
really,
right?
oh my gosh, really learning about inflammation, I noticed that I felt more inflamed when I had gluten. And by no means did I think I had celiac because nobody in my family had it.
Hmm.
I ate gluten containing foods all the time.
Right.
But when I was not eating gluten, that was when I actually got pregnant and stayed pregnant with both of my kids because I was in this listening to my body, decreasing inflammation, and understanding that there's a personal aspect. You and I could be exposed to
Right.
the same thing, and our cells are different,
Right.
and we might experience an inflammatory response differently.
Totally.
And I think that's part of the hard thing when it comes to patients because they always hear my friend did this,
Hmm.
or a doctor tries to give
Right.
this one size fits all. And a lot of women's health is really a personalized approach. What is happening
Absolutely.
to you? How do you feel? So that was the longest introduction to the case that I was always really fascinated by inflammation and fascinated by how the world around us influences us on a cellular level and been diving into that research for over a decade, thinking about how the choices we make every single day can add up to a net negative. Whereas a lot of times we think of them as kind of net neutral or really not impacting us. And there's this nuance when it comes to inflammation. Well, what is it, right? So,
Right.
acute inflammation is your body's immune system activating to do something. And typically, it can be something good. So, if you cut your
Yes.
hand, your immune system is going to be activated and everything's going to go try to heal that cut. And that's a normal process. And even in getting pregnant, we need acute inflammation. So,
Yes.
for ovulation to occur, like your body has to have all the prostaglandins and normal inflammatory response so that your follicle can rupture and release
Right.
an egg. Right. So we always say,
Right.
hey, don't take Motrin or Aleve or ibuprofen in the
No.
middle of your cycle because you can actually prevent follicle rupture and prevent ovulation. So it's not this, I want to go take a medication and fix my inflammation. It's not quite that simple. But what we know is that when the immune system is constantly turned on, this is called chronic inflammation. And your body is not supposed to be at this chronically activated immune system. And chronic inflammation actually interferes with so many different cellular processes within your body. And this is the knowledge that we don't talk about enough, and really the direct link to how it can impact fertility. So, when that chronic activation is happening, if we think about it, it is one directly interfering with how our brain and our ovary communicates. So it actually can interfere with the HPO axis. So the hypothalamus talks to the pituitary gland, talks to your ovary. And we know that women who have higher levels of inflammation, they actually have increased incidence of delayed ovulation and longer menstrual cycles.
Hmm.
And it's right. So
Yeah.
it's like a
Yeah.
direct response where your brain, and I use a bad analogy because I like analogies. And I like to think about it if your brain is air traffic control. So if everything here that's happening within your hormones is, kind of an airport system. So your brain is air traffic control and your ovaries are the plane and they're trying to connect to each other. But if inflammation is like a hailstorm, it's bad weather. So if your brain is not able to communicate well with the plane, or even if it can, if the plane is getting, having delays because of the hailstorm, or if, the radio has a lot of interference on it, suddenly you're in a place where your brain and your ovary are in a disconnect. And
Yeah.
that interference is coming directly from that inflammatory response.
Hmm.
The inflammation also damages our ovarian reserve and our egg quality. And these
Yes.
are two factors that are different but get lumped together. And when we think about it, right, your ovarian reserve is how many eggs that you have. And it's one of those interesting things where we're born with all the eggs we have, you know this, and of course we lose them over time. And when we check markers of ovarian reserve, we're trying to check them at one moment in time.
Right.
But inflammation, I always say, I like to imagine your eggs are kept in a vault within your ovary. And so a lot of times you're just losing eggs every month. And a lot of this is based on how many you have remaining. But there are certain things that can get inside the vault and really harm our
Hmm.
egg count.
Hmm.
And this can be chronic inflammation, chemotherapy, and
Right.
people will often quote things like smoking cigarettes and endometriosis.
Totally.
But a lot of those pathways are through an inflammatory response
Hmm.
directly. So you can have a lowering of your egg count. And then also something you and I both talk about, and I love this because so much of our field talks about, oh, your egg quality is 100% is tied to your age, which it is tied to your age, but it's not solely dependent on your age, right?
Yes.
So
Yes.
many people will say, okay, well, egg quality is just age. And a lot of time that's because it's the best reference markers we have. I like to think of egg quality, and I know you do too, is two components to it. You've got the genetic normalcy,
Yep.
right? Which we know the longer your chromosomes are inside your egg, held in that perfect position before they divide, the higher incidence they are going to get out of order, wear and tear of time. So,
Totally.
of course, there is an age related component. But the whole other aspect of egg quality that gets ignored in the discussion until we bring inflammation in is the metabolic function of how your
Hmm.
eggs function.
Yeah.
The mitochondria come from your eggs that fuel your whole embryos. They have to have cellular competency, they have to divide, and oxidative stress and inflammation can directly harm how your eggs function. So even if your chromosomes are, quote, normal, you have to have good cellular health in order for this
Absolutely.
egg to become an embryo.
Yes.
And then we're not even talking about the male aspect where sperm are
Right.
highly sensitive
Yeah.
to inflammation because they are
Yeah.
created de novo. Every day men create a ton of sperm. One of my favorite facts is they create 1,500 sperm a second if things are working.
It's amazing.
Crazy, right?
Yeah.
So the millions and millions of
Yeah.
sperm created all the time. And so if we're creating so many sperm, we're men are packaging them. And if they're packaging them in an inflammatory environment, not only will they make less, but they also will have decreased function, decreased motility. They can be more abnormally shaped, but the DNA inside the head of the sperm can get packaged incorrectly and they may not function as well.
Hmm.
So when we really think about inflammation on so many different layers, it impacts our reproductive health for both men and women. It impacts for both of us how our brain and our end organs communicate, whether it's your ovaries or your testes, but it also impacts egg and sperm quality. And these factors all come in together. And that's not even talking about implantation, right? So then we have
Right.
implantation, pregnancy loss, the camp that I was in. So we look at these different markers of how your body is supposed to function
Right.
when it's normal.
Right.
And a lot of times your body's giving you red flags that you have inflammation or red flags that things
Hmm.
aren't working.
Hmm.
But because we don't ever talk about them, we don't arm people with that information to see those red flags. They're not in a position to kind of get help earlier. And then we're back to the failure game where, oh, now I'm failing. And then depending on your scenario, you might be pushed into more aggressive treatment, which may be right. But if you're ignoring some of the underlying cause that got you into this place, you're not going to have the outcome you could if we're not addressing, the root cause.
Totally. And now, how would you talk to someone who says, well, I've been doing all the things. I'm eating super nutritious, whole foods, minimal processed foods. I pay attention to my macronutrients. I'm taking my prenatals. I'm taking antioxidants. I'm sleeping well. I'm exercising. I'm doing everything. And I've been doing everything, but it's still not working, even with IVF. So now what?
So I think there's a few different things to think about. I have a very overall healthy patient population, as you do too, right? I'm in Austin, you're in LA. So we
Right.
do see a lot of very health focused people. Even when they say that, I think there's a lot of potentially providers who take that at face value. I say, well, let's dive into it. Because what I find is often it's not somebody's individual fault, but there's so much misinformation about what is, quote, healthy that
Right.
they are still making little changes that are potentially harming them. So number one, if we just say, hey, I'm healthy, I'm like, well, let's just dive into a few things really quick. So if we think about the different things that cause inflammation, there's always disease state, and then there's daily exposure. And I think we have to think about them in two different ways.
Yeah.
So if you have an underlying disease state, let's say you have endometriosis, you have PCOS, you probably have some level of inflammation you'll never get rid of, right? And that's okay,
Yep.
right? I have celiac disease, right? I have some
Right.
level of inflammation I'll never get rid of.
Right.
It's even more important for you to not like add on to the pile with
Yes.
daily life choices because you're already living at an elevated state. And then we do have daily life choices that are important to optimize no matter what. And I'm not sitting here saying let's cure infertility, but I use the word optimize a lot of the time because wouldn't we love to have IVF success faster? Wouldn't we love to get pregnant faster?
Absolutely.
Wouldn't I have loved to not add so many pregnancy losses? You know, my younger sister after I got diagnosed, I called her, she's 8 years younger than me, and she'd had 6 miscarriages. And I was like, you have to get tested for celiac. Oh my gosh, I have it. And she has it. And, you know, she stopped eating gluten, got pregnant right away and stayed pregnant. And our middle sister, who's a fertile myrtle, does not have it, has had no pregnancy losses. And it's not that everybody has celiac, but just like this example of how a simple thing that we were doing in our case, and our bodies had warning signs, but we didn't know how to listen to them, was elevating that inflammatory burden even greater. So to get back to the root of your question, I always say, well, even if we're healthy, like let's address them. And what does this mean? I think the number one thing, even my quote unquote, very health focused patients can do better is sleep better. Find that right? We think like I'm healthy, I eat the right foods, I work out, but often our bodies are really in a state of energy depletion, or we're not giving our bodies time to rest and heal. So we think about it very simply. Sleep is when your body heals inflammation. It is when your brain can send out, you know, anti-inflammatory fighters. It's when melatonin is released, which decreases inflammation, right? It's an antioxidant. And we know even supplementing with melatonin can be advantageous for decreasing inflammation and for fertility outcomes. And so there's this balance between cortisol and melatonin when you sleep. It's when your insulin levels, which I know we'll talk about, can decrease and your cells can become more insulin sensitive. And I like to say this is a reset. This is when your body says, hey, whatever happened to you today, let's get a do-over for tomorrow. But only if you give your body time to get there. And that's really going to take, for most people, about 7.5 hours of sleep at least. And so if we're in a place where we're getting...
At least.
If we're getting...
At least, yeah.
And how many times do I have somebody say, I only need 5 hours of sleep?
Oh my gosh, no.
But people tell me that all the time.
And there's no such thing as I'm different. I can function. Well, just because you're productive in your daily life doesn't mean that this is good for you.
No, it's definitely not optimal. And so there's a difference for us and, you know, doing the bare minimum and saying, what does my body really need?
Yes.
And it's crazy because once you start sleeping enough, what you're going to start to notice is if you don't get enough sleep, you'll start to notice the brain fog, the feeling hungover, the not having that mental clarity because your body's not functioning at optimal state. So I would say this is probably every single patient I see can improve their sleep. So, you know, aim for 7.5 hours of sleeping time, which means getting into the bed before that to start winding down, putting our phones away from us. You know, I love a sleep mask. I love a sound machine. I think setting that right environment. And too often I'll see, you know, a female partner doing all of this. And then her husband's like prancing into bed hours later or has a TV on. And this is a team sport, right? Infertility is a team sport. We've got to make lifestyle changes together. And especially when it's coming to decreasing inflammation, if you live in the same house, sleep in the same bed with this person, we got to have an honest discussion. Like we need the best eggs and sperm we have because even in IVF, I can only work with the eggs and sperm that are given to me. Right. And so there's some level of cellular competence and quality that IVF can't overcome. IVF is an incredible technology. You and I do IVF every single day in our day job. It is amazingly beautiful for what it can do for so many patients, but there's limitations to the science. And a lot of that is because you can work with the eggs and sperm you were given. So
You
especially
can't change the biology, and that's what I always tell patients. Like in the sense of
in the lab, I can't change what
once
you've
we
given me.
acquire it in the lab,
Exactly.
we have what we have. We optimize the lab. That part we control, but it's already been controlled for.
Yes.
So
So yeah, and so sometimes IVF is the answer for some inflammatory disease states. Endo is a great example. One, because we can fertilize in a non-inflammatory environment. We can grow the early embryo in this perfect pH, temperature controlled, nutrient-rich environment, which your body may not always be. So there's amazingly great technology and advancements that we've made on the IVF end. But you still deserve, especially if you're doing IVF. This is not a like, oh, I'm doing IVF, so I'm going to ignore these. To me, especially if you're doing IVF, you deserve to go into that process, which is emotionally draining, physically draining, financially draining, time consuming, knowing we've done everything we can. We brought the best eggs and sperm to the table. I'm not going to spend an ounce of mental energy wishing we'd done something different. And by living a more anti inflammatory life and thinking about our reproductive health and our fertility earlier, it's going to be better. But even my patients going through, right, the 30 days prior are going to be the most sensitive time. So even if you're making changes right now, your IVF cycle is next month, you still can make a positive influence. 90 days before for both eggs and sperm can be even more advantageous. I always say those eggs are kept in the vault, but as they start to line up, about 90 days
right.
beforehand, and in that 30 days that they're really getting selected, they are more sensitive to some of these metabolic influences. So it's not that we're going to change their genetics if we're older,
Right.
but we should say, gosh, I don't need to double down on this hit that I'm going to take as I'm older. So I need to pay even better attention to how I have improved metabolic health. So sleep enough. So I say, hey, okay, so most people are not sleeping enough. So dark environment, cool environment, 7.5 hours, electronics away, make your partner agree with what you're doing. That's going to be the number one change that most people are not doing. I call sleep, stress, and exercise the foundation of your day. It's like the foundation of your health, the foundation of your day. So when it comes to stress, I also think this is another one that especially my healthy patients are not doing and not doing in the right way. And when we think about stress response, very often this gets dismissed. And I hear all the time, my doctor told me not to be stressed about being stressed and not to worry about it. Kind of this nuance of infertility is inherently stressful. Of course, IVF is stressful, but the world is stressful. Every single day, our bodies encounter stress. And I like to walk it back and think about stress and say, okay, very similarly to that inflammation pathway, we can think about how stress impacts our bodies. Stress is an activation of a certain system so you can survive. So if you see a bear, Sasha needs to run from the bear and get away. And so your body wants to change what it's doing.
Goes into fight or flight
It
mode.
does. It wants to get away from the bear. And on a very cellular level, what this does is it starts to say, okay, I'm going to shunt some energy focus away from, certain hormone production, and I'm going to favor others. One thing that it's going to do is free up glucose, and glucose is that fuel for each cell. And it's going to get glucose ready in your bloodstream so that you can run away. It's going to say, hey, everybody's ready to go.
Right.
And if you went and ran from a bear, you would actively use up all of that glucose. But often what's happening is our stressors are not bears. They are emails, bad meetings, encounters with people, bad news appointments. And they are things, these little events that our body thinks are bears, gets all activated, and then we carry on with our day. And these things build up to what's known as chronic stress. And you can have chronic stress from other things too that can be very impactful, right? Truly living through wars, famines, socioeconomic status, post-traumatic stress.
Right.
But also these small little stressors can lead to a place where that stress response is constantly activated. And this starts to do a couple different things. One is it predisposes you to insulin resistance because what is happening is you're constantly having this glucose in your bloodstream. And insulin is the hormone that allows your cells to use glucose.
Right.
So back to my bad analogies, I say insulin's like a salesman at the door, like knocking on the door, hey, let glucose in. And what starts to happen is that your body is meant to eat, use up glucose, and glucose levels lower, then you eat and insulin's released and you use up glucose and it goes lower. So our body's really meant to respond. But in different scenarios, so one is you're eating frequently, you're eating foods that have what's known as a high glycemic index, they cause a higher glucose load, or you're chronically stressed. Where in stress, what happens too is your body actually breaks down glucose from your liver and says, there's a barrier, get more glucose into the bloodstream. So we're adding to this pot right here.
Right.
And what's happening is that insulin sees the glucose is out and comes out in order to allow your cells to use it. But if a salesman came to your door every single day, what would you do?
Oh, you ignore them.
You ignore them.
That's
You're
it.
saying, I'm not going to answer
Yeah.
that. I know what's happening. And your
Right.
cells, that's what your cells do. And that's what
Right.
insulin resistance is.
Yep.
Your body says, I am so sick of seeing the salesman. No, thank you. And it takes them pounding on the door, really high insulin levels to actually get the cell to open up the door and allow glucose in.
And people also don't realize that insulin is a type of growth hormone. So then when you start to gain weight and you have difficulty losing weight and they're like, well, I'm trying everything, it's not working.
Exactly.
It's that elevated insulin.
That elevated insulin causes you to distribute visceral fat. So that
Yes.
fat that's actually around your organs, really metabolically harmful. But your body says, oh my gosh, high insulin levels. Your cells, though, are starved, right? Why would insulin, right? Your cells don't have
Right.
any actual glucose, but insulin is high. And so suddenly now you're depositing fat, you're metabolically energy low at the cellular level. And this high insulin just circulating around also contributes back on the inflammation cascade. So you get into this negative pathway where what is happening is many different things. So again, we'll touch on diet, but we know, okay, well, we're not sleeping enough, so we're starting with higher inflammation levels. Okay, we're chronically stressed, we're releasing more glucose, even if you're eating healthy. You're now breaking down and releasing glucose, causing high insulin levels, causing insulin resistance, causing more visceral fat deposition, and then creating more chronic inflammation. And it's not realistic. It's not realistic to say, go be unstressed, Sasha.
Right.
Right? I mean, it's not, right? But
Yeah.
so I think,
most people who are stressed, for me personally, I feel the inflammation when I'm stressed.
Same.
It affects me so much. I'm very well aware of that feeling, but it's really hard to get rid of it because life keeps happening.
absolutely.
The demand of life continues.
Well, and especially if you're having an extra life event that is adding on top of
Right,
this,
right.
that we don't really have the right tools in our tool belt in order to deal with this. So how I approach this is to say, it's unrealistic to have no stress.
Right.
Okay. So number one, let's decrease stress where we can by setting boundaries, by saying no, by taking things off our plate. So if that can apply to us, we should always take out things that are extraneous. Number two, we need to build into every single day a way to cope with our stress, to say, this day will be stressful. So what will I do to kind of decrease my stress hormones? The stress hormone that's classically released, and most people know about, is called cortisol. It's known as a pro-inflammatory hormone because of the process we just described. But how do we get that feeling, which is that lessening of the cortisol, resensitizing of our cells? And it's going to be really different for each of us. It could be morning sunshine, a walk with the birds, journaling, acupuncture, yoga, therapy, talking with friends. There's not going to be a one size fits all, right? Meditation, mindfulness. We could keep going on the list of things. And I tell everybody 20 minutes a day, you got to pick one. And I don't care which one.
Yeah.
It can be
Love
different every day. It can be the same. But you need to say, today's going to be stressful. I'm going to give myself a time without my phone where I can know I'm going to get that cortisol release and kind of help my body. And then the third aspect of stress management is knowing what you're going to do when you encounter the bear, having a plan for the bear. And very physiologically, one thing that can be very advantageous is to say, if I know I've got extra glucose being released into my bloodstream because I got this really crappy email, if I can use some of that glucose up, so not stress eat, not stress drink, right? Those things are going to only increase my inflammatory burden. Maybe not even stay up late to deal with the problem, but can I get up for 5 minutes and go for a walk or do squats at my desk? Or can I say I've got extra glucose in my body and can I go use it? Because that leads into the fact that skeletal muscle, right, is like giving, glucose a key to the cell. You don't need insulin. You don't need the salesman anymore. Because when you have your skeletal muscle, you're allowing glucose to bypass that insulin pathway. There's a receptor called GLUT4 to transport that helps glucose get directly into the skeletal muscle. So, of course, building and using skeletal muscle is one of the ways we can really fight insulin resistance, therefore decreasing chronic inflammation. But even on a smaller pathway, saying when you have that stressful experience, and you and I both said we can feel it, we know it.
Yeah.
go move your body. And it doesn't have to be a huge workout. Go do 5 minutes of something to
Yeah.
say, okay, I've got this extra glucose chugging around. There's not an actual bear, which physiologically my body wants me to run from it. And then I'd be back to homeostasis. I'd be back to baseline if I ran from the bear. But how can I go use that up quickly? And that's something that I do and that I tell my patients, like, if you leave this appointment, it's bad news. Like, can you go walk for 5 minutes? Can you move your body? Can you do something that is going to help lower that? Right. So now we've got a more comprehensive stress fighting pathway that's going to help us on a day-to-day bit.
Even with dealing with the stress, it's funny. I used to have this therapist
Yes.
who would, and she would always try to talk me through my stress and say, stress sometimes just sort of hits you and you fall. And so you have to have pillows.
Yeah, I love that.
And the pillows catch your fall so that it doesn't hurt as much. And so you have to figure out what your she's like, there's extra large pillows, which are long vacations where you disconnect, but those are not realistic everyday things, obviously. So there's small pillows, and those are the things that you have to do every day that are not making you feel
I love
guilty.
it. So you're like surrounding yourself with small pillows to catch your fall.
Pillows. And so she said it shouldn't be something that you feel guilty about. So if you eating a treat is going to make you feel guilty, that's not a pillow.
Right.
A pillow is like, she's like, what brings you joy? For
And
me,
it's not a way to fight stress.
it's not a way to fight stress. So for me, I was like, it's literally being out in the sun and having the sunlight directly hit me,
Yes.
and I feel like I reset. And so for me, I come to realize living in LA, I'm so lucky where I can literally get a small pillow every single day for free, guilt-free.
Yes.
5 minutes just in the sun.
I
Let it hit your
love
face.
that, how you're focusing that, because how do you put these pillows around you? And we really need to educate and empower people, but specifically women, to say, if you give somebody the knowledge for how their body's working, like, these topics are too often considered too difficult for patients. So they hear stress harms fertility, or, but then they don't really are told what's happening physiologically. They're not giving what they need to actually make longstanding change. But if you educate somebody about what's happening inside their body and on a cellular level, suddenly they're like, oh, that makes so much sense. Why eating that treat or drinking a glass of wine is actually not helping my stress. Now I'm adding to the burden and worsening this process. So if we arm people with the right knowledge so that they can choose actual pillows, right, then they're going to be able to catch themselves better. And I think that's why you and I both also really love, I mean, we're just talking about foundation of the day. Like, these are not huge changes for most people.
Right.
But the last tenet of it is going to be to build and to use skeletal muscle. And when it comes to...
Biggest fan of that.
Yes, right? And so that is going to be, for most people, at a minimum, 3 times a week, strength resistance training. And I see a lot of people still doing a ton of cardio. And it's not that cardio or aerobic activity is bad, right? There's other days.
And in fact, we need some of it.
Absolutely.
Yeah.
It's not that Pilates is bad. It's not that yoga is. Those things, I say, they get to add in based on your preferences, right? Because we're all wired a little bit different.
Right.
But we need to say, for my hormonal health, now and in the future, for my fertility, for my body can best fight against insulin resistance and chronic inflammation if I have some more skeletal muscle, giving glucose the key to get into my cells when it needs to. So that's going to be, for most of us, picking up weights, learning how to move our body. It doesn't have to be scary. It doesn't have to be these huge, long workouts. Nobody has to do the impressive things that you do, right? I mean, even starting with body weight and then moving up.
Yes.
But there is a way to say, I need to put some skeletal muscle on my body.
Right.
It'll also, I mean, aesthetically, you'll end up being happier with how you look too, right? There's a lot of talk about like leanness, but just in society, we see a lot of women focusing being on very thin. Have seen this for a long time. We see it coming back again. Where
it's made a huge comeback.
I know.
Unfortunately.
Yeah. I mean, I think we see like the size of your body as why most people are exercising.
Yeah.
Instead of thinking of, I want to have better fertility. I want to have improved hormones. I want to, have a better perimenopause and menopause. There's so many benefits to long-term health. But I really try to say, well, how many times are you lifting weights?
Right.
And very often my very healthy patients are not.
Correct.
Okay. Yeah. Right. So it's not that they are unhealthy, but they are not doing the things that they need to optimize their hormonal health and to actively decrease inflammation, because we live in an inflammatory world. So we have to fight that by these choices we're making every day. And we haven't even started talking about the gut and nutrition.
Yeah. And those are monster topics.
They are. And this is the hardest one to change. Okay. So I always talk about when it comes to dietary choices and gut health, this feels like a bigger mountain to climb because it is often just different, right? So much of our dietary preference is truly how we were raised, what we were exposed to, what we feel familiar with, or the time that we allot to certain things. But I think if we walk it back and we think about the fact that your gut, your intestines, it's more than just a passive filtration system. I think so many people think about your gut and they think about, oh, it just absorbs my food, la ti da. But if we really think about your gut as an active endocrine organ, your gut has a microbiome, and your gut microbiome is hugely important when it comes to hormonal health and your levels of inflammation and how much insulin resistance you have.
And we even know that there's emerging research showing that it does contribute to that's the environmental component that can contribute to things like PCOS and endometriosis.
Absolutely. Absolutely. So it's a cellularly active system, and it can be harmed and it can be optimized. So the gut microbiome itself, right? So the bacteria inside your gut, which are supposed to be optimized, they're really important, and they make enzymes. They make something called beta glucuronidase, which helps in estrogen metabolism. So if you don't have enough of that, you're suddenly not going to be metabolizing estrogen properly, which is going to interfere obviously with hormone feedback. There are also, metabolic byproducts that the gut is making, short chain fatty acids, which are important in their endocrine communicators. So they can interfere directly with how your hormones work, including insulin, including your hypothalamic hormones.
Yep.
And so this system is so metabolically active, but also you can do things that negatively not just change the gut microbiome, but do change the permeability of your gut, because it's a single lined kind of system. All these cells are right next to each other. And when you're eating foods that are highly inflammatory, that they can cause separation of these different gut cells, that's called increased intestinal permeability. And then you are letting more direct inflammatory markers into your bloodstream. So let's say you eat some highly processed food. So in addition to having like non-nutritional value, you're going to change your gut microbiome. You're going to worsen the leakiness of your gut, directly increasing inflammation, directly increasing your, insulin resistance, worsening how your brain is contributing. And yet what feeds your gut is fiber. So fiber is what feeds your gut. This is found in fruits and vegetables to like the biggest extent, also in some of your grains, but it's not found in animal products. And that doesn't inherently mean all animal products are bad, but it does inherently mean fruits and vegetables should be the primary thing that you are eating during the day, not a side addition to your meal, which is how most of us were taught to approach food. Right? Huge protein, tiny little thing of grains, tiny little thing of vegetables. And really, we need 2 to 3 servings of fruits and vegetables at every meal. We need to be getting 25 to 30 grams of fiber a day. And if you start thinking about this, most people are not getting that. And there's a huge love obsession in America with protein. And I do love protein too. But I wish we had a love obsession with fiber. Because when it comes to hormonal health specifically, focusing on fiber is going to improve that gut microbiome, and it is going to downstream improve your inflammation. So we talk about eating foods that are going to have a positive benefit on your fertility. We want to see a lot of whole foods, a lot of fruits and vegetables, right? Doesn't mean that all meats are bad, but if you're going to have animal products, we want them to really be ones that are lower on the inflammatory scale. A lot of, we'll just say not all animal meat's created equal. Right? And there's a lot of endocrine disrupting chemicals that can be there, a lot that's highly inflammatory, but we know like the increased servings of red meat that people have, the worse IVF outcomes we see, right? We see less embryo quality.
High correlation with endometriosis with high red meat intake.
Exactly. And so we know that it's not net neutral. So I tell my patients from a dietary standpoint, because we could talk about the whole podcast, could be just about nutritional health and how that impacts fertility. And it's a large focus of the book. But I say, like, let's make this achievable. So meatless Monday. Okay, automatically for the majority of people, they're going to have to think outside their box. And that's good. Okay. The other days of the week, try to focus on only 1 to 2 servings of meat. So you're kind of decreasing it. And by decreasing that, you're going to first have to increase your fruit and vegetable intake and increase your fiber. Red meat should only be once a week. Okay. And so I'm in Texas, right? So this is a major change for a lot of people on the pros. And then we're decreasing those ultra processed foods, decreasing, added sugar and artificial sugar, things that are non-nutritional and just highly inflammatory. And a lot of those are convenience foods because you are taking a bar and you're putting it in your bag and you're busy. But in addition to it having the inflammatory properties based on the processing to keep it shelf stable, a lot of the packaging has chemicals and endocrine disruptors in it. So you get a double hit from that one.
Even if you open the packaging of a protein bar, you literally see the glue coming off of it.
I know, and
really
it's there
gross,
and absorbing into your food.
Yeah, it's really gross, honestly.
I know, and so that leads into the bigger discussion of a lot of endocrine disruptors do enter our world through the foods that we eat in our kitchen practices.
And you can't avoid them all.
You can't. No, it's unrealistic to think that you could avoid everything that's causing, environmental harm. But, the products you put in and on your body, the, packaging of your food, the things in your kitchen, right? The Teflon pan, the plastics, those are things you absolutely can modify. And then when it comes to, smaller things, thinking about, the air quality inside your home, thinking about, your water, those are things that you're exposed to every day. So that's where you can have the biggest impact when it comes to environmental chemicals and endocrine disrupting factors. And then, of course, toxic behaviors that we've normalized, drinking alcohol, cannabis use. I think smoking cigarettes, vaping, right?
Easy.
These things are normalized inflammatory behaviors.
I agree with everything that you said. It's so much of what I do with counseling patients. I love that your book goes into so much detail to explain it, because in a consultation, and even in short form social media clips, you just can't get into this much depth. Even on a podcast episode, you can't. And so at the end of the day, reading a book, getting into the nitty gritty is where it's at. And I think you did an amazing job with it.
Sasha, thank you. Yeah, and the book is really walking you through. In the first part, we're talking about inflammation and what I wish everybody knew about their fertility. So things about ovarian reserve and egg quality and your hormones and your menstrual cycle. And then we're diving into tracking your cycle and what happens if you have abnormal cycles, what you should do if you want to get pregnant or if you have infertility. And then the last half of the book is everything we discussed in length about how these daily choices add up. Because this narrative that, some people just have bad luck, I don't love it, because to me, what is luck? Something you have no control over. But you have control over the knowledge, how you prepare for something, how you advocate for yourself, the questions you ask, the doctor you see, the choices you make every single day. Those things are not luck. That is preparation, knowledge, and making the best decisions you can with the data you have. And to me, that's really taking control of your reproductive health.
I love it. Well, thank you so much, Natalie, for joining me today. It's been an incredible conversation.
Thank you so much. I love you, and I'm so thrilled to be on your show.
Thank you.